I want you to imagine something with me for a moment. It's late at night. The house is quiet. You lie down, close your eyes, and drift into sleep the same way you've done for decades. You believe sleep is the safest part of your day. Your body finally gets to rest, your brain finally slows down. But what if I told you that the way you sleep tonight could quietly raise your risk of a stroke before you wake up in the morning? As a brain doctor, I wish I could say this isn't true. I wish I could tell you that sleep is always harmless. But the truth shocked me too. After years of working with stroke patients, reviewing brain scans, and listening to families ask the same heartbreaking question, "Doctor, it happened overnight. How?" I began to notice a pattern that most people never talk about. And it has nothing to do with bad luck. It has nothing to do with age alone. And it's not always about blood pressure or cholesterol either. Very often, it's about how someone sleeps. I remember a patient in her early 70s. She was active, careful with her diet, took her medications, and never missed a checkup. One morning, her husband couldn't wake her properly. She was confused. Her speech was slurred. By the time she reached the hospital, she had already suffered a stroke. When I asked about the night before, her husband said something simple, something that didn't seem important at all. "She slept the way she always does." That sentence stayed with me. Because for many seniors, the way I always sleep may be silently working against the brain. In this video, I'm going to talk to you honestly, calmly, and clearly, the way I would speak to my own parents. I'm going to explain which sleeping position has been linked to higher stroke risk overnight, why it affects the brain while you're unconscious, and what simple changes can dramatically lower that risk without fear, without expensive treatments, and without complicated routines. And please understand this. This is not about scaring you. This is about giving you power. Because once you know this, you can protect your brain starting tonight. Here's something most people don't realize. A large number of strokes happen in the early morning hours, right after waking up. Doctors have known this for years. Blood pressure changes. Blood thickens slightly overnight. Oxygen levels can drop. The brain becomes more vulnerable while you sleep. Now combine that natural vulnerability with a sleeping position that restricts blood flow or breathing, even slightly, and you have a perfect storm. And the scary part? You don't feel it happening. You're asleep. Your brain can't warn you with pain. Your body can't ask you to change position. That's why this matters so much for seniors. As we age, the brain becomes more sensitive to oxygen changes and blood flow interruptions. What didn't affect you at 40 can become dangerous at 60 or 70. The same sleeping habit you've had for decades may no longer be safe for your brain. In a moment, I'll explain exactly which sleeping position concerns me the most as a brain doctor and why it places silent stress on the arteries that feed your brain. I'll also explain why many people believe this position is comfortable or even healthy when in reality, it may be doing the opposite. And if you stay with me until the end of this video, you'll also learn how to choose a safer sleeping position, how to adjust your pillow and body in a gentle way, and how to reduce overnight stroke risk naturally without medication changes, just by working with your body instead of against it. Let me ask you something important. When you wake up in the morning, do you ever feel groggy, foggy, or heavy-headed? Do you ever wake up with a stiff neck, numb arm, or slight dizziness that fades after a while? Many people dismiss these signs as just getting older, but as a brain doctor, I can tell you that these small signals often come from what happens to the brain during sleep. Your brain never truly rests. Even at night, it needs a steady supply of oxygen-rich blood. Anything that interferes with that flow, even mildly, even temporarily, can stress delicate brain tissue over time. And night after night, that stress adds up. This is why I say I'm shocked. Because the risk is hiding in plain sight. People focus on diet, exercise, and pills, but they overlook the 8 hours when the brain is most unprotected. In the next part, I'll walk you through the science in a simple, human way. No complicated terms, no scary statistics. Just clear explanations and real-life understanding, so you can finally connect the dots between sleep, blood flow, and stroke risk. But first, I want you to promise me something. Don't assume this doesn't apply to you. Don't assume your sleeping position is harmless just because it feels familiar. Your brain deserves better than assumptions. Stay with me. Let's talk calmly now, and let's talk clearly, because understanding this is what gives you control. When we sleep, our brain depends on two things more than anything else: steady blood flow and steady oxygen. During the day, gravity helps blood circulate as we sit, stand, and move. At night, gravity works differently. Your body position suddenly matters much more than people realize. The sleeping position that concerns me most as a brain doctor is sleeping flat on your back, especially with the head low or with a thick pillow pushing the neck forward. I know this may surprise you. Many people believe sleeping on the back is neutral or even the best position. Some doctors even recommend it for back pain. But when it comes to the brain and stroke risk, especially in seniors, this position can quietly create problems overnight. Here's why in simple terms. When you lie flat on your back, gravity allows the tongue and soft tissues of the throat to fall backward. This can partially block the airway. You may not fully stop breathing, but your breathing can become shallow. Oxygen levels can dip again and again through the night without you knowing it. This is especially common as we age because throat muscles lose tone. Now combine that with another issue. Lying flat can increase pressure in the chest and neck. For some people, especially those with stiff arteries, this position can slightly reduce blood return from the brain. The veins draining blood from your head don't empty as efficiently. Pressure builds quietly. The brain doesn't like pressure. Over hours, this combination lower oxygen and subtle blood flow changes puts stress on brain tissue. Most nights, the body compensates. But on the wrong night, under the wrong conditions, that stress can cross a line. This is why so many strokes happen in the early morning. I've had patients tell me, "Doctor, I went to bed feeling fine," and I believe them. Nothing dramatic happened. No warning pain, no symptoms. Just hours of silent strain while the brain was vulnerable. Now let me clear up a very common myth. People often think, if I snore, it's annoying but harmless. That's not always true. Snoring is a sign that airflow is restricted. And restricted airflow means fluctuating oxygen levels. Over time, this can raise blood pressure at night, strain blood vessels, and increase clot risk. When someone snores loudly while lying on their back, the brain may be getting less oxygen than it needs. Another myth is, I've slept this way my whole life, so it must be fine. Aging changes the equation. Blood vessels become less flexible. The brain becomes more sensitive to drops in oxygen. Recovery slows. What your body tolerated at 40 may become risky at 65. I want to share a pattern I've seen again and again. Many stroke patients describe waking up with symptoms, not developing them during the day. That timing matters. It tells us the trigger often happens during sleep. And here's the part that frustrates me as a doctor. This risk is rarely discussed in routine checkups. No one asks, how do you sleep? But if we asked that question more often, I truly believe we could prevent many brain injuries. Let me ask you something now, and answer it honestly in your mind. Do you usually fall asleep on your back? Do you wake up in the same position? Do you ever wake up with a dry mouth, headache, or foggy thinking that clears after an hour? These are clues, not diagnoses. Just signals that the brain may not be getting ideal conditions overnight. Now, I want to be very clear and very reassuring. This does not mean everyone who sleeps on their back will have a stroke, absolutely not. But for seniors, especially those with high blood pressure, diabetes, heart issues, or a history of mini-strokes, this position can add unnecessary risk. The good news, and this is important, is that this is one of the easiest risks to reduce. No surgery, no pills. No complicated devices for most people, just awareness and small changes. In the next part, I'll guide you through safer sleeping positions for the brain, how to train your body to stay in them comfortably, and what simple nighttime habits can protect your brain while you sleep. And please stay with me, because one small mistake many people make when changing sleep positions can actually make things worse. I'll help you avoid that. Now let's talk about what you can do starting tonight, in a way that feels gentle, realistic, and reassuring. First, the safest sleeping position for the brain in most seniors is sleeping on your side, especially the left side. When you sleep on your side, gravity works with your body instead of against it. The airway stays more open. Breathing becomes deeper and more stable. Oxygen levels remain more consistent throughout the night. Blood drains from the brain more efficiently, reducing pressure inside delicate vessels. Many people tell me, "Doctor, I try to sleep on my side, but I always roll onto my back." That's very common, and it's not a failure. Your body is simply used to what feels familiar. The goal is not perfection. The goal is improvement. A simple trick I often recommend is using a firm pillow or a rolled towel behind your back when you lie on your side. This creates gentle resistance, so when your body tries to roll flat, it naturally stays angled instead. Some people even place a pillow between their knees. This keeps the spine aligned and makes side sleeping feel more comfortable, not forced. Now let's talk about the pillow under your head, because this is where many people accidentally make things worse. A very thick pillow that pushes your head forward can bend the neck and partially compress the arteries supplying the brain. A pillow that is too flat can let the head drop backward, straining the neck. What you want is a pillow that keeps your head in a neutral position, in line with your spine, whether you're on your side or slightly elevated. For seniors, slight head elevation can be helpful. Raising the head of the bed just a few inches or using a wedge pillow can reduce pressure in the brain and improve nighttime breathing. This is especially useful if you have high blood pressure, reflux, or snoring. Here's another habit that makes a real difference: what you do in the hour before sleep. Heavy meals late at night push up against the diaphragm and make breathing shallower when you lie down. Alcohol before bed relaxes throat muscles, increasing airway collapse. Even large amounts of water right before sleep can disturb rest and increase nighttime. Blood pressure swings due to frequent waking. Instead, aim for a light evening meal. Finish eating at least 2 to 3 hours before bed, and limit alcohol in the evening. These small changes protect the brain quietly while you sleep. Now let's address a very common mistake. Some people hear "don't sleep on your back" and panic. They force themselves into uncomfortable positions, tense their muscles, and sleep poorly. Poor sleep itself raises stroke risk, so comfort matters. The goal is a relaxed side position, not rigid control. If you wake up on your back during the night, don't panic. Gently roll back to your side and go back to sleep. Anxiety has no place here. Consistency matters more than perfection. Daytime habits also play a role in nighttime brain safety. Gentle daily movement improves circulation. Proper hydration during the day keeps blood from becoming too thick overnight. Managing blood pressure, even modestly, reduces stress on brain vessels while you sleep. And please remember this: sleep is not passive. It is an active time of brain maintenance. Your brain clears waste, restores connections, and balances blood flow while you rest. Giving it the right position is like giving it the right environment to heal. I've seen patients reduce morning headaches, brain fog, and even nighttime blood pressure spikes simply by changing how they sleep. These are not miracles. They are biology responding to better conditions. In the final part, I want to speak to you heart to heart. I want to explain why this knowledge matters so deeply, how small choices can protect your independence, and how to move forward without fear, but with confidence. Before we finish, I want you to understand something very important. This conversation is not about fear. It's about respect for your brain, for your years of experience, and for the life you still want to live fully and independently. I've sat with too many families who said, "If only we had known," and every time I hear that, I think about how many strokes don't come from dramatic events, but from small, repeated stresses that add up quietly over time. Sleep is one of those silent hours where the brain either heals or struggles. The beautiful truth is this: tonight can be different. You don't need to change everything about your life. You don't need to become perfect. You just need to make your sleep work for you, not against you. By choosing a safer sleeping position, supporting your neck properly, and creating a calm nighttime routine, you are sending a powerful message to your brain. You matter, and I'm protecting you. I want you to picture yourself waking up feeling clearer, steadier, and more rested. Not rushed, not foggy. Just quietly strong. Those mornings matter. They protect your independence. They protect your ability to speak, walk, think, and enjoy time with the people you love. As a brain doctor, I can tell you this with complete honesty. Prevention is not about doing something dramatic once. It's about small, kind choices repeated every day. Sleep is one of the kindest choices you can make for your brain. If this message helped you see your health in a new way, take a moment to support this channel. Like this video so more seniors can hear this information. Subscribe so you don't miss future videos designed to protect your brain, heart, and independence. And leave a comment below, letting me know how you usually sleep on your back, your side, or if you're planning to make a change tonight. Your brain has carried you through a lifetime of memories, challenges, and love. It deserves protection, especially while you rest. Sleep well, protect your brain, and I'll see you in the next video.